Hi, and welcome to 3 o'clock with SOC. I'm Marisol Diaz, Communications and Digital Manager. Give me a moment while I welcome our Spanish-speaking residents. Buenas tardes, gracias por estar con nosotros hoy en 3 en punto con SOC. Si quieren oír este programa en español, favor de marcar el número que aparece en la pantalla, que es 646-749-3122, y la contraseña para entrar es 779-328-221. And just a reminder that you can access this show and previous shows on our Facebook page in the videos area and on YouTube. Now I'll pass it over to our moderator of the day, who will introduce today's topic.
Hi, everyone. Welcome to 3 o'clock with SOC today. My name is Marlaina Jackson, and I'm the SOC project coordinator. So I just want to introduce the forum team that's also working behind the scenes. We have Marisol, which is producing today, and we also have Alan, who is doing comments in the comment section. I just want to let everyone know that the staff and platforms are still available to the community virtually. You can definitely contact SOC at 414-672-8090 if you need any help with resources. And you can also email us at soc@socmilwaukee.org. And you can check out our website at www.socmilwaukee.org. We just want everyone to complete our SOC survey, so go ahead and do that for us. The SOC survey link will be in the comment section, but it helps us really understand what the viewers will want us to showcase on the forum and answer any questions that you may have, or possibly better understand what we can fix for the forum. All of SOC staff is working virtually from home, and that is why you see me on the screen not wearing a mask. We'd love to know who's here, so go ahead and put in the comment section your name, and maybe even leave an emoji, just because we want to see who's here and who's with us. A quick disclaimer that the views and opinions shared today do not necessarily reflect those of SOC. Quickly, some announcements. Today is the COVID-19 day. Today's guest, we are playing a video that we have with Marlaina Jackson, the Interim Commissioner of the Public Health Department, and she's going to be going over misconceptions of the COVID-19 vaccine. Tomorrow's guest will be Lieutenant Lorenzo, talking about fire safety from the Milwaukee Fire Department. And it's also the Community Organizing and Leadership Team Day. So now, no further ado, I'd like to introduce Marlaina Jackson's video. Now I'd like to introduce our guest, Marlaina Jackson, the Interim Commissioner of the Milwaukee Public Health Department. Hello, Marlaina. Great to have you on again.
Hi, how are you, Marlaina?
Great. I see that you are wearing your mask, rocking the Milwaukee Public Health masks. Yeah, we've been distributing a lot of those actually with the community, since SOC is now a hub for mask distribution. I just want to say it's a really great time to have you on right now, just because of the current fast-paced movement of the COVID-19 vaccine distribution and COVID itself. There's lots of updates that are happening on a daily basis. I want to confirm that you're currently still the interim commissioner, correct? Or did I get that wrong? Okay, just making sure there were any changes to that. Glad to have you on. Thank you for taking Claire Evers' spot for today. It was really awesome of you. Okay, so let's get started. So currently, can you talk to us about who can get the COVID-19 vaccine?
Yeah, Marlene, I'm happy to answer that question. If I can, though, before I wanted to just share something that just happened in the legislature as it relates to the mask mandate, and I just wanted to make sure that it was clear for all of our City of Milwaukee residents. So the ability or the mask mandate that had been put in place by Governor Evers late last fall was struck down by the legislature today, meaning that the state mask mandate is no longer in place. And so you will hear a lot about that in the next couple of days, I'm sure, on the media. But I want to be clear that for the city of Milwaukee, masks are still required in public places and when you are out and around people. So know that, and that was because our Common Council passed legislation around the mask ordinance. So I just want to be clear that as you hear things about masks, know that masks are still one of the main ways that we stop COVID. And then therefore, and they are then required here in the city of Milwaukee. So with that, thanks for just giving me that moment to share that. So as it relates to who can get vaccinated, so right now, Group 1A, which is healthcare workers, and a healthcare worker, for an example, are nurses, doctors, therapists. They're also personal care workers or home care workers. Social workers also fall in that group now, as well as other licensed providers, medical assistants, CNAs, LPNs are all considered 1A healthcare workers. They are now eligible for vaccines. In addition to that, individuals that fall into any work for security or safety, as well as first responders. And first responders are individuals like the firefighters, emergency or paramedic individuals, as well as shelters. So if you are in a shelter or if you work or staff at a shelter, that is also considered emergency services work, and you qualify right now for the vaccine. And lastly, individuals who are 65 years old or older also qualify for the vaccine. And I can talk about registration if that's okay.
Definitely. That was our next. Yes.
That's what I thought. So I'll just keep rolling. So right now, for our registration, we have a scheduling system that you individuals can go to sign up and actually directly schedule. That website, and I if it's not in the chat, I can put it in the chat, is milwaukee.gov/COVID-vax. If you go to that website, there's questions around scheduling an appointment, and then it'll walk you through to make sure that you fit into one of those groups that we just named. From there, you can go ahead and schedule. We are working right now on getting that information in Spanish. It's not right now, it's only in English. And so know that we also have our hotline available, which is 286-6800. If you call the hotline and press option 5, you will be able to get to an individual who either, we do have bilingual individuals who staff our hotline, or they will use a language line to assist you in getting an appointment. So with that said, I would just share that we don't have enough vaccines right now for everybody who wants to schedule. Mm-hmm. And that is really important because I can tell you that if you go to our site right now, there's going to be no appointments for the next few days because all of the appointments have been taken up. So what we're asking individuals to do is to go back daily to check. And once there's new appointments open, then you will see that there. You will see an actual ability to go through and schedule. And I would just say that we don't have vaccine. It is a state and a national issue. So it's not a city of Milwaukee or a county issue. There's just not enough vaccine right now for everyone who wants to get vaccinated. So unfortunately, our schedules will be full very, very quickly. And so if you don't get in, just keep trying.
Of course. Yes, thank you for sharing that. Are there other platforms that individuals should register through, or is this one the main one that will get them through all the other platforms?
Yeah, so right now, if you're a City of Milwaukee resident, then yes, this is the best, most likely the best place. I will share with you that if you are 65 and older, a number of the health systems have sent communications to those groups as well. So Freighter, St. Mary's, Ascension have sent communications to their patients who are 65 and older to get registered, to get appointments within their own personal doctors. So if for individuals who have a medical home or a primary care doctor, they should definitely call them because they might be able to get in sooner than with the city. But again, because we don't have lots of vaccine, and that's the health systems too, it's a state issue. So everybody who's vaccinating has just a little bit of vaccine.
Yeah. Thank you for sharing that. So now I have a question for you. Lots of individuals have been asking on the forum, what are the chances of individuals getting a COVID vaccine allergic reaction? What are doctors and physicians doing to monitor this?
Yeah, so that's a great question. And I think that's one of the biggest fears that people have to getting the COVID-19 vaccine. And what I can share with you is that typically the typical reactions to COVID-19 are most of the times a sore arm. Sometimes there is a fever or chills within 24 hours, anywhere from 12 to 24 hours after your initial dose. And that is not common at all. It actually is just as common as any reaction to any other vaccine. So the COVID-19 vaccine doesn't have more individuals reacting than your flu vaccine would. We're talking about symptoms of the shot. That's what we're noticing. And so for individuals who have had reactions to vaccines in the past, they should talk to their medical doctor or their medical provider first before getting the vaccine. But for individuals who have had vaccines in the past and have not had reactions, then there is no medical reason for them to not get a COVID vaccine at this point.
Okay. Awesome.
Okay.
I do have one more question for you before we are wrapping up. There were some concerns that if someone does get their first COVID-19 shot, and let's say they have a allergic reaction to it, or they for some reason decide not to get the second one, do you know if there are any side effects to that?
Right. So generally, no. And there are individuals who, again, that they have had some of those reactions. I think there have been more moderate type reactions of individuals just having tiredness and muscle aches, those kind of things. But those are, again, resolving themselves within that 24 hours. If you get your first shot, you are protected. That provides some level of protection against getting COVID-19. But we do know that the 2 doses is what gives you the 95% protection. So that's really what you want to do if you can. But if there's a reason that for whatever reason you can't go back to get that second shot, then know that first shot is definitely providing some level of protection for you.
Okay. Awesome. And another one that 16th Street Clinic wanted me to ask you is, do you know what the current status is for COVID-19 vaccination distribution for Milwaukee? How many vaccines will we be getting in to the city based on the new presidential administration?
Yeah, I unfortunately we don't know exact numbers. We know as it relates to numbers of vaccine for the particular city of Milwaukee. What we know is that there are over 200 vaccinators, meaning individual organizations that have applied to provide vaccine to the public at some level. And we know that also the state is relooking at how they're distributing those vaccines, because we know here in the city of Milwaukee and in the county that we have not only the most dense population, but also the most diverse, which means when we look at who is affected by COVID-19, it is significantly more impactful to Black and Brown people. And with that, we know that. So we have been we've advocated as much as we can to the state to say we need the most vaccine and we need it the soonest. So we'll continue to do that. But to answer that question, I know that the state had a request of over 300,000 vaccines doses, and they only got around 78,000 for the entire state. So if you think about that demand, again, we know that there are so many people right now that want to get vaccinated that we literally just don't have the vaccine for right now.
And one more question off the top of my head. Can people still infect others even if they have had the vaccine?
So again, the vaccine it's an immunization like any other. So it doesn't 100% guarantee. Again, it's that 95 or so percent protection. So if you are one of the rare individuals that have gotten both your doses, and you then still contract COVID-19, then yes, you can absolutely spread it. You do still have that contagion time, but know that again, it's very unlikely that if you've gotten both those doses that you would get COVID-19.
So there is a period that when you do get the vaccine and you have symptoms, you could infect others?
Oh, I'm sorry. No. I'm sorry. I misunderstood your question. So no. Yeah. So when you get the vaccine is not active COVID-19. So there's not an injection of a real live virus into your system. So once you have those symptoms, what the symptoms are really your body, just your immune system reacting to what it thinks is COVID. And that is what is really, I think, great about medical advancements, is that we can make things that your body thinks it's COVID. It's not, so you don't have as bad a reaction as you would if it really was COVID. But you don't spread it. There's nothing to spread. You don't have active disease.
Okay, awesome. Thank you for explaining that. That was something that was a concern for other viewers.
Sure.
Awesome. So thank you for your time, Marlaina. We'd love to have you on again. And it's always great and a pleasure to have you on. Thank you.
Yeah, nice to see you again.
You too. Sorry, I was muted. That was a great interview that I had with Marlaina Jackson, and she really talked about the vaccine and broke down some of the questions that many of you had. And now I'm going to check to see who said hello. So Alan said hello. Hi, Alan. Kelly Johnson, hello. And that is all that I see here. So now I have a video that I recorded of I'm talking about the COVID-19 vaccine, and essentially can pregnant women get the COVID-19 vaccine, and also will we be getting the COVID-19 vaccine? Will we continue wearing the mask even after getting COVID-19, the vaccine? Hello, everyone, and welcome to 3 o'clock with SOC. My name is Marlene Zaran, and I'm the current public health coordinator here at the Southside Organizing Center. Today, I just wanted to go ahead and show you guys how you can register for your COVID-19 vaccine if you do fall under the phase 1A population. So once you go to this site, the site is called, it is the Milwaukee Public Health Department site, and you can go to city.milwaukee.gov COVID Vax. And on this site, you will see here that it shows you which individuals are currently eligible to receive their COVID-19 vaccines. And then it also goes, if you go down, you'll see the Register Now button. And that Register Now button will give you access to register for your COVID-19 vaccine. And so it should look like this. And then it says eligible individuals will be allowed to schedule their initial vaccination appointment, which can generally be scheduled 1 to 14 days in advance based upon the vaccine availability. Please note you will be required to show proof of eligibility at your appointment. And then in order to schedule your appointment, you will need to provide a phone number and email address. Follow-up appointments will be scheduled on site after you receive your initial vaccine dose. If you do not have both an email or phone number or need additional assistance, you can contact the Milwaukee Health Department hotline at 414-628-6800 or email at askmhdcovid19@milwaukee.gov. We will have these for you in the comments section. So that is that. And then I'm going to now give you some COVID-19 updates that were just released to the community, to the United States through Johns Hopkins University. So one thing that I want to talk about is, will you still need a mask and will you still need to wear a mask even after you receive both doses of the COVID-19 vaccine? The answer to that is yes. You should still wear a mask, practice social distancing, and frequently wash your hands even if you receive the COVID-19 vaccine. I want you to please note that protection from the vaccine is not perfect. It remains unknown if you can still spread the virus to other people once you have been vaccinated. A new hope is that as more vaccines are approved and become available, and as more people get vaccinated, we'll be able to resume the activities we missed in the last year. Good news though, restrictions like mask wearing and social distancing will be eased over time as the level of the virus in the community drops. Another thing I want to go over is pregnancy and the COVID-19 vaccines, what you need to know. According to Johns Hopkins University, Johns Hopkins Bloomberg School of Public Health, they have stated that if you are pregnant, it is your choice if you would like to get the COVID-19 vaccine. COVID can be riskier if you're pregnant, so getting vaccinated could be a good idea. For any concerns beyond this, we recommend talking to your doctor. Can the vaccine give the baby COVID if you are currently pregnant? Neither of the authorized vaccines contain live virus. The vaccine cannot give you or your baby COVID-19. If you're trying to get pregnant, should you get the COVID-19 vaccine? The vaccine won't affect your fertility and can keep you and your baby safe from COVID. So that is all that I have for you guys for today. I hope everyone has a great rest of your day, and I will see you guys tomorrow for some live updates on COVID-19 numbers. Thank you. All right, so that was me earlier in the day. So now that we have all of the links for you guys in the comments section, the article from where the Johns Hopkins information came from regarding pregnancy and COVID-19, if you want to go ahead and read that. We also put the email address for if you have any questions about the COVID-19 vaccine. You can go to askmhdcovid19@milwaukee.gov. And we have the link in there as well for you to register through the Milwaukee Public Health Department to get COVID-19 vaccine. And now we have a civic update for you guys.
So vote411.org is the League's voter information tool. We've got a ton of info on the site from, registering to vote, photo ID information, absentee and early voting information as well. And it's really great because you can type in your address and get information that is personalized to where you live. And it's a nationwide tool. So if you move to another state, this is still a resource that you can come back to. Although right now I'm going to focus on the candidate information that's available on the site, which is populated by us at the state level and then also by local leagues in the communities that they work in as well. So to find candidate information, what you do is you click on the What's on Your Ballot button and then enter your address. For this example, I'm going to type in SOC's address so that we can see something local to Milwaukee.
Perfect.
Great.
Yeah, so for anyone that doesn't know, our address is 1300 South Layton Boulevard. When we are all back in person, we'll be happy to have a visit from you all there. 53215.
Thank you. I had it up, but I trying to check back between two screens. So once you type in your address, you get directed to this screen. One of the great things about Vote 411 is we also have information in Spanish as well as English. So once you type in your address, you can actually choose your language, either English or Spanish.
Great.
For this example, I'm going to go through it in English. So I just click go to my races, and you can see the different races that we have candidate information for. You know, big one that everyone's thinking about is the presidential election, but there are a lot of local races and down ballot races that, you know, sometimes they're the harder ones to get to find candidate information for. So at the top, we have kind of a description of what the job is, what the duties are of that particular office. And I know that can be really helpful too in evaluating candidates. Is like for some of the, especially the more local races, I'm like, I'm not even sure what these people do. So it's hard to evaluate a candidate if you don't know you're supposed to be evaluating them against.
Exactly.
So we have the description. We have the list of candidates that are going to be that are on the ballot. And if you want to compare candidates, you just click on their name or their picture and then click compare. And you can see some biographical information, which for this particular one is mostly just the campaign website links and Facebook and email. And so if you have questions for a candidate, you can find their contact information, shoot them a question about, you know, what their thoughts are on a particular issue. You can go here, you can find links to their website, so you don't have to do the research yourself. You can just come here as a one-stop shop and a jumping off point. And then we have different questions that the league has asked candidates, and if they've answered, this is where their responses are. And not every candidate always chooses to respond to our questions, but we do include the candidate, all the candidates in our guide, and have asked all the candidates to respond, and are continuing to follow up to get even more participation.
And even if they don't respond, having that description of the duty and the position that they're running for is really, really interesting and helpful for voters.
All right, so that was a great video. Thank you, Gabe, for recording that. And now we have a SOC feature with you. We have one of my close friends, Crystal Sanchez, who's a nurse from Broider Hospital. She's going to be talking about heart health in the African American and Black community and the Latinox community and heart disease. Hi, everyone. My name is Marlaina Jackson, and I am the Public Health Coordinator for the Southside Organizing Center. Today we're going to cover heart health in the United States. I have with me Crystal Sanchez, a nurse at Freud Hospital, and she's going to kind of give us an update about heart health since February is Heart Health Month in the US. So Crystal, can you explain to us what are some heart health facts we should know about the Black and Latino OAX community in the United States?
Yeah, so according to the CDC, heart disease is the leading cause of death in both Black or African American non-Hispanic population and the Latino X community. About 20.3% of Hispanic males get heart disease in the United States. In Wisconsin, men live an average of almost 5 years less than women. This is very similar to the situation for men and women in the rest of the United States.
Okay, awesome. Thank you for sharing that information. So quickly, one more thing we'd like to know is, what is coronary artery disease or heart disease?
Coronary artery disease, also known as coronary heart disease, or simply heart disease, involves the reduction of blood flow to the heart muscle due to buildup of plaque in the arteries of the heart. It is most common of the cardiovascular diseases. The types include stable angina, unstable angina, myocardial infarction, and sudden cardiac death. A common symptom is chest pain or discomfort, which may travel into the shoulder, arm, back, neck, or jaw. And occasionally it may feel like heartburn, which is commonly seen in women. Usually symptoms occur with exercise or emotional stress, last less than a few minutes, and improve with rest. Shortness of breath may also occur, and sometimes no symptoms are present. In many cases, the first sign is a heart attack. Other complications include heart failure or an abnormal heartbeat.
Oops, I was muted. Thank you for sharing that information with us, Crystal. We appreciate your time with us, and we thank you for coming on.
Thank you.
All right. So that was a great interview. Take care of your health, everybody. We understand there's a lot of health disparities that limit Black and brown folks from reaching healthcare and healthcare access. But it's important to try to check up on yourself whenever you can. Yeah. And now for our SOC survey promo.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.
Thank you. And Alan just put that survey link in the comments section. Please fill it out. We'd love to get your feedback on what you think of the forum. So I'm going to leave you guys with some quick reminders for the rest of the week, which is tomorrow. Tomorrow we're having Lieutenant Lorenzo come on to talk about fire safety in Milwaukee. And then I'd just like to say our thoughts and prayers do go with those that have been affected by COVID-19, especially those that have had severe illness and death. So that's all that I have for you guys for today. I'll leave you with some Funder partner thank yous.
Hola, SOC viewers. My name is Andrea Rodriguez, and I'm the Leadership Coordinator for Southside Organizing Center. We would like to thank everyone for supporting our 3 o'clock with SOC live show and for completing our very important SOC survey. In addition to thanking our residents for tuning in and for sharing our show, we would also like to thank the following sponsors: Wisconsin Voices, Community Development Block Grants, Neo Philanthropy State Infrastructure Fund, Movement Voter Project, Catholic Campaign for Human Development, Zilber Foundation, City of Milwaukee Office of Violence Prevention, Tides Foundation, City of Milwaukee Promise Zones, and all the faithful individuals like yourself who support SOC through their personal donations. Gracias.